Hi, if you are planning a visit with your dermatologist for the first time consultation, this video is for you. I'm Dr. Punit Saraogi and I'll teach you how to prepare yourself for your consultation so as to get maximum out of it. Step number 1, definitely prioritize. Make a list of your concerns that you need to discuss with your dermatologist. It's very common to see that, say, the pressing issue that you're visiting a dermatologist to today may be hair loss. But at the same time, there are so many knickknacks, so many small concerns that you have kind of accumulated over the years. For example, dark elbows and knees. For example, a chipped nail, a birthmark that you've had. That kind of, when you start addressing this in your consultation, it dilutes the process. So it's always good to have a list of your concerns that you want to talk to the dermatologist about. Divide these into two. Primary concern, those are your focus points. And secondary concerns are by the ways you just want to discuss them, so that the consultation is kind of divided and we don't lose focus from your main issues. At the same time, make a list of the questions that has been bothering you about your primary concern. It could be about the concern, it could be about the treatment, it could be something that you've seen on the internet, all of that. Second, prepare for your consultation. What do I mean by that is, after you've made a list of your primary concerns, you also need to take all the relevant reports, blood tests, previous prescriptions from any past dermatologist that you visited, and also your current skincare and hair care routine. It's very common to ask patients what they are using and they don't know what they are using, they don't remember the name of the cream that you're using. Best, if you have a few products, including your makeup products, carry them along. If not, just take a quick picture and then you can show this to the dermatologist. Third thing, if you're doing a video consultation, it's always best to send very clear pictures and videos before your consultation, because the video clarity in most of the applications, WhatsApp or a FaceTime or a Zoom, is not as good as a clear picture that you send. How do you know whether the picture is clear? Well, you know what your problem is. When you take a picture, if you zoom in, are you able to see the problem very well and clearly? If you can, then that's a clear picture. Don't send selfies, don't send blurred images. On the day of your consultation, when you know that your particular consultation is at a particular time, prepare yourself, choose a quiet corner in the house, use a headphone and don't move around. So this way you'll be able to hear the consultation thoroughly well. Choose a spot which has good network and you can get maximum out of your consultation. So point number 5, it's the last tip which will facilitate a better consultation process. If you have a pre-booked appointment time, check with the clinic what time are you expected to be taken in. And also if there are any delays that you're expecting, you should definitely communicate that to the clinic well in advance. That way your consultation time will not get compromised just because of a delay. On the day of your consultation, some quick tips. First, don't wear makeup to your consultation. It's okay to use your moisturizer, it's okay to use a non-tinted sunscreen, but that's it, because it will be easier to examine your skin. If you have any nail concerns like chipped nails or fungal infections, etc., don't wear nail paint, use a nail paint remover so that the nail can be examined. If you're coming in for a hair consultation or a scalp concern such as dandruff, it's best not to immediately wash your hair before your consultation. It can be washed a day before, that should be more ideal. This is not strict, but if you do that, it's most ideal. And especially if you're going to see me or Dr. Pramila at Everything Skin and Hair Clinic, we always encourage you to send your concerned pictures, all your reports and your blood tests as well as previous prescriptions much in advance, so that we have enough time to kind of go through it before you've come in for your consultation, which saves a lot of time during your consultation. So assuming you've had a great first consultation, you had your queries sorted and you've put on a regime. Now when you follow your regime, there may be a lot of follow-up questions that come to your mind. If your follow-up question is something which is urgent and which needs immediate attention, definitely call the clinic up and I'm sure they will help you out. If you feel these are general inquiries, it's best to keep noting down these inquiries so that you can again address all of these concerns face to face when you see a dermatologist the second time. I'm glad you've taken the step to kind of prepare yourself for your consultation and you'll get the maximum out of it. Keep shining.